Time is running out. The deadline to enroll in a healthcare plan through the ACA is only 1 month away from today. So what are you waiting for? We have experts to help you navigate the process. Catherine Sevier is with AARP of North Carolina. Morgan Campbell is with Alliance Insurance Services. And Laura Packard is with Get America Covered. They are all here to answer your questions about ACA, healthcare plans, insurance, and Medicare as well. Here's how you get your question to these experts. You're going to text those questions 336-379-5775. Remember, this is a text only, so please don't call. All right, Laura, first and foremost, let's start off with the deadline. We want to put it up on the screen, make sure everybody sees it and everything, so that they know what's going to happen August 15th.
Yes, as far as we know, the deadline for signing up for affordable health insurance through the ACA is August 15th at healthcare.gov.
And I love what you said, as far as we know, because we've had a lot of changes throughout this last year.
It's not impossible that they'll extend it, but don't count on that.
Okay,
it's not impossible. The deadline for now is August 15th.
Okay, August 15th is it. So we wanted to make sure that you guys got that. You know, it is 1 month from today. So a lot of times people go on the website and they are just overwhelmed with all of the things when they see all those plans. Morgan, we've talked before, but if this is the first time someone has been here, talking to an insurance agent about this is not going to cost them. In fact, it could actually save them money. So let's talk about that.
Absolutely. So agents should not be charging you any type of fee. We are paid commission, so that does not come out of your pocket at all. And we can help you navigate all of the plans and compare them for you. So we can double check to make sure your primary care physicians and your specialists are in your network that you're looking at. And we can also even do a deep dive and we can look at your medications to see exactly where they're at on each plan's formulary. So we're making sure you get the best bang for your buck.
Okay, and speaking about the best bang for your buck, Laura, if people are like, well, I guess my plan from last year is fine, I don't even want to go through the hassle, you would always say, yes, you need to take a look at it again, because why?
Well, there's a whole lot of new plans, and also the American Rescue Plan subsidies made existing plans a lot cheaper. So go to healthcare.gov and check it out again.
Okay, so again, we are taking your questions on ACA, healthcare, and health insurance as a whole. We're also going to be taking your questions about Medicare. And so Catherine Sevier is with AARP, and you guys have a brand new tool that can help with all the complicatedness of Medicare too.
Absolutely. So we've updated a lot of our information. So if you go to aarp.org/health/Medicare, there is an incredible amount of information there, and there are FAQs so that most of the common questions get answered.
Okay, and so one of the most common questions that is asked, and we're probably going to answer it maybe 5 times in the next 15 minutes, we'll see, is when do I sign up for Medicare? And there is a specific time that you have to sign up for Medicare.
Absolutely. And that, with all the things that are changing out there, has not changed one iota. 3 months before your 65th birthday, 3 months after, in the month of your birthday. So there's a 7-month window where you need to sign up. You need to sign up, and you need to understand that if you don't, and you don't take Medicare Part B, you are at risk for having a penalty for the rest of your life if you decide to take it later.
Right, and that whole Part B thing has been interesting. We've talked about it a lot. Morgan, a lot of people are like, yeah, but can't I just defer it? But you have to do some specific things.
You absolutely can defer it if you have credible coverage through your employer. You need to always check with your HR department to make sure that coverage is deemed credible. If not, you will receive a penalty. Also, you need to look at a prescription drug plan, the Part D, because if you defer that as well, you will be subject to a penalty when you do decide to enroll in a prescription drug plan. So both of that coverage needs to be verified through your HR department and deemed as credible coverage, meaning as good as or better than Medicare.
All right. And folks, don't feel overwhelmed with thinking to yourself, oh my gosh, I don't understand all this stuff. None of us know all of this stuff, which is why there are experts all the time that we go to and we talk to, and then they are experts talk to experts. So that's okay to ask questions, no problem. Laura, this person is saying, are insurance premium subsidies taxable?
That's a good question, and you do have to. You have to include your income to find out what you apply for.
Okay.
But actually, I'll kick this over to Morgan to give a more detailed answer.
Health insurance premiums taxable, possibly through an employer, but not through the exchange or the marketplace. No.
Okay, they are not taxable income like an unemployment benefit or something of that nature. Okay, just wanted to make sure. And again, we're trying to answer all the crazy, complicated questions that we can for you. It's okay if we have to look stuff up in the middle time and we come back after the break and we figure some other stuff out. We're going to continue to take your text questions. We'll be right back in just a minute. All right, we have Morgan Campbell, Laura Packard, and Catherine Sevier here answering your questions about healthcare enrollment and also Medicare. So, Morgan, this person says, I went through the process and it said mine would be over $700 a month in premiums. I'm unemployed and my husband gets disability.
So I think that person would definitely qualify for a substantial tax credit. You have to be careful when you're entering the income in the income section. You have to specifically put in what your income is and what your spouse's income is. And if you mess with the wrong button, so let's say maybe you put $200 and you click the yearly button, that throws off your entire household income and your eligibility results at the end.
Okay, great. This person says, has the deadline always been August 15th? I thought it was December 15th. Now we're talking about two different things. This is a special enrollment period that goes until August 15th. So then what's the December 15th deadline, Laura?
Well, the December 15th deadline is for the normal enrollment period. So this is a special enrollment period because of COVID, but a proposed change to the normal enrollment period is November 1st to January 15th. That's not final, but it's under discussion.
Right, and so if you sign up by August 15th, you're covered until the end of this year. When you sign up until December 15th, or if that gets moved, that is for the entire next year. So everybody should know that. All right, Catherine, this person says, when do you sign up for a Medicare supplement? And is there a timeline on that? Oh, you're muted.
Sorry about that. There is open enrollment for Medicare supplements, as well as there are the other enrollment periods for ACA. However, you could have a qualifying event during that time, and then you would be eligible to sign up in between. But normally, it's that fall period again. It's usually that November 1 to December 15th period. But watch out, because those things are changing as the dates move for all of us.
Okay, and that's just the supplements. That's not Medicare. Again, you have to sign up at 65, the 3 months beforehand, the month of your birthday, or the 3 months after. That's the time that you sign up. All right, Laura, this person says, can you get insurance if you didn't have it before the pandemic?
Yes, this is exactly what the special enrollment period is for.
Okay. All right. And let's talk about some new legislation that may be coming down the pike that may change all of healthcare.
Yes, right now Congress is debating an infrastructure bill, a couple bills actually, and there's all kinds of healthcare pieces in those bills you should be paying attention to. One of the pieces would expand Medicaid in states like North Carolina that did not, so that low-income people can access to free or affordable healthcare through Medicaid. And another would strengthen Medicare to include vision and dental and hearing, as well as take the temporary tax subsidies in the American Rescue Plan for the Affordable Care Act and make them permanent.
Okay. All right. We'll be looking for that. Hey, Morgan, this person says, if you have Medicare, can you sign up for the Affordable Care Act to help you with incidentals that Medicare doesn't pay?
No, you cannot. If you are entitled to Medicare, you need to have your Part A, you need to enroll in Part B, and select either a Medicare supplement with the prescription and a prescription drug plan, or enroll in a Medicare Advantage plan.
Okay, so when this person says, will I be eligible for the ACA insurance after 65? It's cheaper than Medicare. The answer is no, you will not be able to do that. Okay. All right, and then this person says, I'm 65, I'd like to make an appointment with someone face-to-face, but they're all working from home. What should I do to make sure I'm signing up for the right thing? Catherine, I think that's the AARP tool.
It is. It is. And then you can look for people who are starting to be back in their community seeing people.
All right, so what we want to let you know is that August 15th, again, you've got 1 month until the deadline for that special enrollment. Right now, in the Who Wants to Know section, we have the resources so that you can see the marketplace, so that you can understand that you can talk to an insurance agent for free to be able to find that out. And then we have the AARP tool so that you can get your questions answered about Medicare. All of that is in the Who Wants to Know section.